Next, we'll be talking about the grading and the scoring criteria for your OSCE day. Even for your technical day, it doesn't really differ. Now, of course, the grading and the assessment is done according to a global scaling procedure, which has been basically mentioned in the ADC handbook. The main thing that you would need to know is grading and the assessment are of course done by the examiners, and they're trained examiners who are dentists. So they follow a particular definite criteria or a predetermined listing of criterias to score you. These are not exactly revealed by ADC as to what the criteria are, but you can see a sample of it in the ADC handbook. These criteria are also called rubrics in short. The global rating scale is used to score your overall performance, and you can see in the handbook too, which I have added a few clips of it in the next few slides. You can be basically graded as outstanding, pass, borderline, fail, or a bad fail. So that brings me back to the same topic that I had talked earlier in this video, where I said that your OSCEs cannot be a fail or a bad fail. You can have a borderline, you can have a pass, and that's when you basically clear a cluster. All the criteria that they follow are standardized, so we can't really, question that or know much about it. This is all that we know. The final result is again derived from something called a partial compensatory test scoring model, which is a model they follow by themselves, and this gives them an unbiased overall result for a candidate. Again, like I said, one has to pass both the days of the examination and all the clusters to have an overall pass in the examination. Now, like I said, I will be adding a few examples of the OSCE scenarios which are given in the handbook. Here you can see a particular scenario where there is also an OPG which has been given, and you are going to see a very similar type of a scenario with a relevant picture when you enter your OSCE communication room. This, for example, comes from the diagnosis and management cluster. Also, another thing that is very important to know is when you're reading the scenario, you will see a particular line which has been darkened, or basically it's in bold, just like in this particular slide. The last line which says, explain your diagnosis to Mrs. Wilson and work towards getting informed consent for your management plan. This basically helps us to understand it's a diagnosis and management cluster. Also, it tells us exactly what the examiner is basically, expecting from us to cover in the particular case presentation. More details regarding these scenario discussions will be covered in further videos, so don't worry about that. Here is basically a clipping of the example of the OSCE scoring criteria or the rubrics, which I had mentioned earlier in the video. You can see that it has been basically categorized into very good, satisfactory, borderline, and unsatisfactory. Our goal in the examination needs to be that we are in the very good or satisfactory criteria, and maybe at times, in case there is a blunder, borderline. We should always make sure that our particular performance in the exam does not go towards unsatisfactory, because we might just lose on the particular task or even the cluster. Under the observation section, it talks about certain points. For example, the first one says signs and symptoms identified and discussed. So for you to get a very good mark here, you need to cover all the points which have been mentioned under it, namely comprehensive identification, discussions of signs and symptoms, smoking, family history, OPG, deposits, bleeding on probing depth, etc. And for you to be basically scoring unsatisfactory, you would not be identifying or discussing any of the important signs and symptoms which have been mentioned in the very good category. So this is basically how the scoring is done, which is just an overview that I have given you today. We'll make sure to basically link all the important handbook as well as the website links, which will lead you to the ADC Part 2 examination part of the website. And a few things that you would require to know is Like I have been repeatedly saying, an overall pass in the Part 2 examination is achieved only when you pass all the clusters of each of the technical skills and the clinical skills here. We will soon come out with videos for technical as well as the infection control part of this particular exam. So make sure you stay tuned. Like I always say, make sure you like, share and subscribe to our channel. It really helps us to get motivated and work on making better videos for you. Make sure to have a look at our description box because all our social media handles will be basically mentioned there, as well as the ADC handbook and the other links which you require. Also, we have our own ADC Part 1 coaching. So if you're planning on your ADC journey, make sure you have a look at that too. Thank you so much.